Kenya is one of the countries that is on course in meeting the World Health Assembly targets. And those targets are in stunting, wasting, underweight, and anemia among women. So we are on track, but it doesn't mean that we have reached the target. Many years back, around 2000, though nutrition had been there for many years, we used to have emergencies and partners used to come and do what they can to help us save the lives of children and women and even other adults in emergency situations. So there was no coordination really. Nutrition was just a small unit. And using the emergency situation, we started in around 2005 to bring partners together. And most of those partners were focusing on emergency. And we formed a technical forum where they would come and share what they are doing. So that is how actually the coordination started. And partners used to come and report on what they have done. And most of the times the government didn't have a clear way forward on how to move. That's when we thought, then if we have to come up with our policy, which we were working on at that time, then we must show how it's going to be coordinated. We started early. So after that, we formed now technical working groups, steering committees to focus on particular areas that were of interest. That is like maternal, infant, and young child nutrition. We have a steering committee, and also micronutrients and emergency. So we have now formed all those technical working groups that are helping us to coordinate the issues of policy, capacity building at national level, and would like to cascade the same to the counties. So currently, all these technical committees are reporting to the Nutrition Interagency Coordination Committee. And this committee now can report to the highest level, where we would like to have the coordination of food security and nutrition. And that is likely to be maybe Office of the President. When the country joined the Scaling Up Nutrition in 2012, looking at what is required in scaling up nutrition, we decided to form networks. And the government network is one of the strong networks that we should be having. But first of all, before that, we never used to have very close interaction. But now we have officers who have been appointed by the various ministries, and we are able to meet quarterly. And we discuss issues on what we are supposed to be doing as various ministries. So this has worked very well in helping us understand each other's role in scaling up nutrition. For example, we have education, and the Ministry of Education are very key in ensuring that our children learn about good nutrition, they practice it, and also they're able to feed well in school so that they're also protected. And then agriculture, of course, without the food, we are not able to feed well. So we are now working closely, and I think as we move along, we'll be able now to report centrally, and each of us will take responsibility more than we used to do. At national level, we have a budget, clear written nutrition, and we used to have, before devolution, funds from Treasury allocated to that. Even now, we have some little funding, and the problem is at the county level because there is no allocation showing that this is nutrition money for nutrition. But anyhow, they are able to plan and get resources under in some counties, they are talking about a department that deals with community health, and that is where they are able to get resources and use for nutrition. But the financing mechanism is at national level. We receive funds directly from Treasury as Ministry of Health. And for the counties, they also receive, each county, funds for their county. And at the county level, they give priorities to various ministries. So then when they give to health, then health again will prioritize which are the key activities under health. But we are seeing there's improvement. They are taking nutrition positively and they're getting resources here and there. At the moment, we are in the process of we are doing financial tracking. And we've looked at the trends within the government where the monies are being allocated. But with donors, we are working on a modality of having information coming together so that we're able to see how much each donor is giving to nutrition. But currently, the donors are funding NGOs directly, and sometimes through UNICEF, sometimes directly to the government through Treasury. So we've had support through World Bank, we've had EU, we have USAID, and UNICEF has been supporting all the activities in nutrition, especially targeting children and women. We have the business network, and as a government, we embrace the private-public partnerships. And even before scaling up nutrition, we were working together with the private sector, especially food industry, to start the food fortification. At the moment, we have improved and engaged further. We've gone to the communication companies like our communication company, Safaricom. They are supporting mothers at the workplace, which is one of our recommendations, so that they're able to breastfeed and take care of their children. So that is going to be scaled up to all the companies, the private companies that are in the country. Already there is an engagement between Ministry of Health, UNICEF, and the Kenya Private Sector Alliance to sensitize the industries and the companies on the issues of infant feeding, and also to encourage them to support the mothers as they work. So that is ongoing, and we are hoping we'll engage more. Yes, I've had a chance of meeting the government focal points for Tanzania, for South Sudan, for Zambia, and we've met through the conference calls that we have every 6 weeks, where we are sharing, and we've had meetings, the Sun Global Gathering, where we interacted and were able to share materials and also discuss on how we are moving. We also had a workshop recently in Nairobi, and many of them came, so I'm able to interact with them through that forum. Scaling up nutrition is about, bringing the people together, engaging them. But we cannot do that unless they know what it is all about. So we need more support to be able to communicate more, to pass information to the relevant people, and also even to reach out to the communities where the people are waiting for our services, so that we see how they are performing. So that is one of the things I would really wish for. Of course, as a country, when we hear of a movement on an issue that is of concern to all of us, we couldn't like to be left behind. So we joined so that we can also share what we have and also learn from others and also be part of what the global team on nutrition are guiding on. So that is very important to us, and we are always, wanting to share and also be together with other people. I love what I do, and what I was trained to do is improve lives through good nutrition, and I'm very excited to be part of the team that is spearheading the issues of nutrition in my country. More so, I would like to see my contribution to changing the lives of people in the country. Just before I became the head of nutrition, I was spearheading the food fortification program in Kenya. It was an uphill task because we are dealing with private sector for the first time, and we expected that it was going to be very difficult, but I realized that when you bring people together, you're able to do big things. That was a great achievement for me, because at the end of it, the targets that we had set were met. So now in Kenya, all people are getting fortified foods on the shelves in the supermarkets. Whenever I see that, I always get excited. There's one thing I feel has a great impact. You know, we're talking about our children, and children are our future. So I would like to see one thing happen, that all our children in schools are receiving nutritious meals and they're well protected. Because at that point, they will learn about nutrition, they will feed well, and they will be better parents in the future, so that we don't have to wait until they give birth and then we start teaching them how to take care of their children. So we are working on the school curriculum. I wish that could be implemented in Kenya. And the school feeding program, it could be spread out to every county. Some counties have started. I would love to see every county doing something about our children in school.